Good morning, everyone. Bob Ravenscroft, the Vice President for Advancement at Bryan Health. Today, it's just John here. Couple of things to announce before we get into a lot of mobile screening, more activity in Crete to share with you. Wanted to mention last week was National Medical Laboratory Professionals Week, which I failed to mention when Christy was here. But what a great week to celebrate that week when our lab unveiled and the testing analyzation capabilities. And then I would just like to mention April is National Occupational Therapy Month. Our OC therapists are doing great work. Some of the patients that we report in our daily census that are non-COVID are people receiving therapy and so forth, so be thinking of them. And then lastly, April is National Donate a Life Month. So I ask everyone, either on Facebook, through the media, our friends there, to pause, think, consider being an organ donor yourself. It's easy. You designate it on your driver's license and take a moment to think of the donors and recipients sometime this month. So if you know it, and we've talked about connectedness during COVID, if you know of someone who has been a member of their family has been an organ donor or a recipient, it'd be a great month to reach out to them and just let them know you're thinking of them. John's going to cover mobile screening schedule, a third day in Crete. As you know, we were about half capacity the first day, full capacity the second day, and this morning we're full again. And I think you're going to basically, a lot of people have been asking about the surge, when it's coming. I think we're feeling the surge now. You'll see that from some of the numbers. Our midnight census is 386. Bryan Easy visits, 11,368 have been completed, with 3,633 resulting in an easy visit for some type of treatment, and 1,715 have used the COVID promo code. Before I mention the daily stats, I'm sure that all of you received the news release from the governor's office just about an hour ago, where it talked about the COVID dashboard is currently experiencing difficulties. As a result, the state's COVID-19 totals are only partially reflected in the system. And then it goes on to, the numbers reported by your local officials and so forth should be considered the most up-to-date. That's what we've been doing here, is we've been giving you the most up-to-date numbers at Bryan. Of course, most of them are Lancaster County. Not all of them are. So John will share a little bit about that process we go through in reporting our numbers to the state and how that works. But let's get right with it. So far tested at Bryan, there have been 3,162. As a point of reference, 7 days ago, it was 2,131. Positives tested through Bryan have now reached 254. 7 days ago, it was 111. We have 2,578 negative, and right now we have 330 pending. So with that, I'll turn it over to John, and then we'll be available for questions.
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center, and today we have 14 positive COVID patients in-house. 4 are on a ventilator, 6 are in our intensive care unit, 2 are in our progressive care unit, and 6 in our general care unit. As Bob mentioned, we are down at Crete again. This morning we started at 8:30 and it should be winding up about now. I think we filled that with 160 patients again. And I believe on Friday, I think the National Guard's going to support that area once again. The process for testing, and when we get results back, those go or should be processed automatically to the state. You heard Bob make the announcement about a glitch in their system. So we're actually going into our system, running the data for the past 2 to 3 days, and we will share that with our local health department to assure that all of the positives that we've received back matches their records. So we do have a mechanism to verify that the information going through is accurate, and we will continue to work with all the health departments. So any positive that we would have received from the health department in the Crete area, we will go ahead and re-verify all those numbers. This process is to be automated, that as these results come from different labs, it's sent into their system so they can do follow-up. We do have conversations back and forth about verifying numbers, and that's where I think this type of identification is notified or or brought to our attention that were saying, hey, some of the numbers aren't lining up. So, that's what happens with computer systems. We'll make sure that we work through that. But to just let you know, we do have a mechanism of a check and balance to assure that any positive patient we're able to get to, the appropriate follow-up can be done, the investigative work can be done, and that's part of the nice relationship that we have with our local health department and in working with our public officials. So with that, I would take any questions that anyone might have via chat. This is the highest number of positive COVID patients we've had in the hospital at 14. This is part of that surge that we thought would occur. We're still with our modeling, believe, and that changes depending on how many positives we have per day that we put into this model, that our peak should be somewhere around the 11th of May. From a ventilator perspective, we're actually showing less than what we had modeled. So that is a good sign, and it could be due to the fact that we're testing people earlier, we're getting that isolation to occur. People are following the rules of the social distancing and that. Those are all key factors. And I think what we're seeing is a good sign from the aspect that the number of severely ill people are not as high as the model is showing of what has been experienced in other parts of the country.
Yeah, I think it's the increase of people feeling they need the test, qualifying to get the test after they go through the screening, and then the number of positives that are occurring. So, I think another way to look at that is, geez, we have a 100% increase in 7 days in the total positives. But when you have over 3,000 people tested just by Bryan alone, that's 3,000 people who don't feel good for one reason or another. So I think you're definitely seeing that. It is the numbers are going up because we can now test more and get our readings quicker, but it's because more people need tested.
We are pretty confident that we can handle the surge as what's being predicted in the model right now. I think we've stated this in the past. It all depends upon everybody following these guidelines. If you have an outbreak in an area, that can change things very quickly. But from what we're even seeing with the outbreak in the Crete area, we're feeling very confident. We continue to work with a lot of other hospitals. We have had patients come from other communities into the Bryan system. That is perfectly fine. That's what we do each and every day. So right now we're very confident for what we're seeing in the anticipation of where the surge will continue to grow through about the 11th of May. It could go a little bit longer, but then hopefully we'll see a downward trend.
There's a lot of attention on Crete. I think we mentioned it yesterday. It's important to note that everyone who works at the kind of employer in question down there are not all Saline County residents. Some of them can be Lancaster. But as far as how positives are breaking down by the drive-through, hospital, urgent care, mobile, we have 147 positives that have materialized through our drive-through clinic, 52 at the hospital, 22 at our walk-up urgent care clinic, and 33 at the mobile. So this spike is not just coming because of what has happened with mobile testing primarily in Crete right now. No, basically my comments on the surge was we've talked about the surge many, many times through here, and you're now feeling it. That was all factored in on what we believe we can handle with electives.
It is amazing to watch this team continue to get stronger and come together in support of this community. From the physician side, we are in constant contact with our medical staff. They are helping us make these decisions when we talk about elective surgeries, when we talk about our approaches to different things and putting in mobile units and how we process just day-to-day activities in this organization. I think our physicians are very confident. I think their morale is good. We would not be making this move without the guidance of our medical staff, Lancaster County Medical Society, our health department. This is not just Bryan making a decision. It is a collaborative effort with all of our healthcare providers in this community.
You know, one thing that the public wouldn't necessarily see, but every week we make a couple of little videos for our workforce, and it's showing people at home working, and then people here all peppered up doing their thing. And I would say the vast majority of the people who are working remotely at home, they wish they could be here. You know, so as you're talking about the spirit of the workforce, it's pretty much determination right now, and people wishing they could do more if possible.
More than likely, you're seeing underlying conditions with these individuals to the point that they need to be hospitalized. As you've seen, there are a number of people that could be COVID positive, but it's a mild symptom to them. It's the compromised individuals. And, you know, luckily we only have 4 of those individuals in-house that are on a ventilator. But as Bob has shared in previous press releases, we have a number of these people that are recovering and going home and living normal lives again. So good outcomes are happening from this, long as we stay on top of it, catch it early enough, and do the proper interventions with folks. I'd say probably by the end of this week we'll have some additional dates for you. We will probably make a return visit to Crete, but we will do a location or 2 within the Lincoln area. We're still just working on the appropriate spots so that we can give easier access to people for the testing.